Joining me in today's health segment from Chittick Eye Care is Dr. David Sola Del Val. Welcome back, Dr. Sola.
Thank you. Thank you for having me.
Last time you were here, we were talking all things glaucoma. Let's kind of revisit what it is and what people need to know about it.
Absolutely. So glaucoma, the definition of glaucoma is optic nerve damage. And the optic nerve is that cable that connects the back of the eye to the back of the brain where the images get processed. Usually glaucoma happens when there's elevated eye pressure or a lot of fluid buildup in the eye, and that optic nerve in the back of the eye gets thin and damaged, and people can go blind, if it doesn't get treated appropriately.
Okay, so let's talk about the research being done when it comes to glaucoma and how that's looking.
Yeah, there's a lot of research being done in glaucoma nowadays. I actually run a clinical research lab at Harvard right now, and I have at least 30 different research projects going on, and we're studying everything from how to detect it earlier, how to come up with better treatments that are less onerous for the patients. There's so much in glaucoma, so we could talk for hours about the research happening in glaucoma. But,
well, it sounds like we could with all those different studies
absolutely.
that you have going on, and that has to be exciting for you.
It is very exciting. I'm actually hoping to continue some of the research here actually when I come to Illinois, which is will be great.
Well, and how great for us here in Central Illinois to have such a prestigious doctor who treats glaucomic as well as other things. Let's talk a little bit about how people who may be feeling changes with their vision, maybe having that diagnosis of glaucoma, how they can be treated.
Absolutely. So first, I want to remind the viewers, glaucoma is usually a silent disease, so it's important to get checked early on and discovered early. But usually one of the main treatments for glaucoma is eye drops. And there's at least 5 different types of eye drops that we use. And it depends on how high your pressure is and how bad your glaucoma is, the stage of your glaucoma. And basically, depending on that, we decide what eye drops to give you. But I have some patients who unfortunately sometimes have to use 5, 6 eye drops a day to keep their pressure under control before we go to the next step of surgery.
So an eye drop can help with pressure?
It can, absolutely. All the eye drops that we prescribe now help lower the eye pressure by either decreasing fluid production in the eye or helping the drainage of the fluid in the eye. Because remember, that's what happens in glaucoma. There's fluid buildup that ends up damaging that optic nerve. So we're just trying to lower that pressure.
Wow. Okay, the neuroprotective strategies out there, what are those?
Yeah, well, there's still none that are FDA approved, but we're working really hard. Even my lab at Harvard actually is working on something called galectin-3 inhibitors. It sounds very scary, but it's basically we're trying to find IOP or intraocular pressure independent ways to treat glaucoma. As we talked just now, the eye drops we have right now, they treat the eye pressure, but we're trying to find other ways to treat it that are independent of the eye pressure so that we can protect the optic nerve regardless of what the pressure is.
Okay. You said it sounds scary, but I wasn't scared until you said it sounds scary. So, okay, if you mentioned it being a silent kind of disease, so how do we know?
I know.
Is it too late?
No, it's never too late to come see us. I want to make that clear. It's always good to come if you have any signs or symptoms. But again, most patients with glaucoma don't have any signs or symptoms. So it's important to get checked if you have any risk factors for glaucoma, which we covered in another segment. If you have family history, if you're a certain age, over 60, if you're an African-American, Hispanic patient, if you use steroids, if you have diabetes. I mean, there's a lot of risk factors of glaucoma. Look them up, and if you have any of them, please get checked.
Very good. And then after you WebMD yourself, no, I'm kidding. Definitely go and see Dr. Sola there at Chittick Eye Care. There's a look, again, at some of those risk factors that you may want to consider if you're noticing some changes with your vision. And there's their website where we will post after today's show at our website. Dr. Sola, thank you so much. This is interesting stuff here that we're learning about, and we're glad that you're now part of our community.
Thank you. Thank you for having me.
All right. We appreciate Chittick Eye Care for sponsoring our segment today. Again, we'll connect you. ciLiving.tv.